But we begin with the dire COVID situation in Saskatchewan. The fourth wave continues to put pressure on the province's healthcare system and the ICUs, prompting the federal government to step in and send some much-needed help. Natalie Collada is tracking this story for us. And Natalie, what do we know about the military's deployment to the province?
Well, we know, Chris, that help is on the way, and that is, of course, what health officials and experts, doctors, nurses, even the people of Saskatchewan have been looking for. We know that the military is going to be deployed to Saskatchewan. The Canadian Forces will be sent there. A tweet from Justin Trudeau, the Prime Minister, last night announcing that fact, and then a following tweet by Bill Blair, the Minister of Public Safety, saying it's not just going to be the armed forces that are going. They are in discussions with members of the Canadian Red Cross to send additional personnel. The hope is, Chris, is that this will help alleviate some of the pressure that is being seen and felt in the province's healthcare system, particularly in the ICU. You have to remember, currently officials are saying that Saskatchewan, as it stands right now, has the worst weekly death rate in the entire country. Yesterday, 12 deaths were reported, 308 people were reported as hospitalized, and we are expecting new numbers to come out at about 3:30 Eastern time, so we will be watching for that. The situation there so bad, the Chief Medical Officer of Health for the province began to cry as he projected and presented the modeling for the next couple of months, very much concerned about the situation there and the impact on the healthcare system. We talked to one infectious disease specialist, Dr. Alexander Wong, who akined what's happening in the province right now to that of a bathtub filling with water. He says in ICUs, it's the patients are the water, the bathtub is the number of ICU beds. And the problem is, because COVID takes so long to recover from, people aren't cycling through. But the water, it's still coming.
The challenge with COVID and the fact that we have so many people coming in with COVID right now is the fact that when a COVID positive individual comes into the hospital, the average stay for that individual in the ICU is like weeks, like 5-6 weeks, because COVID just destroys their lungs, and it takes weeks and weeks for that individual to recover if they're going to recover. And so essentially that's kind of like, really kind of putting a stopper on the drain, because now all of a sudden, instead of people moving out at a steady pace, you're essentially kind of putting a stopper on it, and you're not getting any flow through. The drain is kind of blocked now.
And it's why, Chris, he says that extra personnel from the military will be helpful. But what doctors are also calling for in the province are additional temporary health measures to stop the spread of COVID-19, particularly, they say, gathering limits. That is something they want to see happen. Otherwise, they say the water, Chris, it's just going to keep coming.
Okay, interesting. And all of this coming as authorities are showing us that the number of children in hospital with COVID-19 has gone up in the province. What's going on there?
That's right. And just a little disclaimer here. This is really about math. So we know that typically children don't get as sick with COVID-19, but because we're seeing the percentages of people with COVID-19 go up, you're also going to see the percentages of children who get COVID-19 and need to be hospitalized also going up. That being said, we know that a third of the cases in Saskatchewan right now are children under the age of 12, with one doctor in Saskatoon telling us 17 children were admitted into hospital over the last week. That's quite a lot if you consider, the fact that kids generally don't get admitted into the hospital, and they say this will likely continue to happen as the numbers and spreading of COVID-19 continues. We've heard from Saskatchewan Teachers Federation, who are calling for more stringent measures coming from the top, coming from the government, asking for a blanket vaccine mandate, because right now in Saskatchewan it's up to different school boards to determine their own vaccine mandate. We know that masking came in a little bit late there, so that is, of course, a little bit of a concern as well.
And especially concerning for so many parents, because a lot of these young children, of course, are not able to get vaccinated yet. Thanks for the latest on this, Natalie.